Andy Chrisman of For Him has spent 40 plus years in Christian music, and chances are he knows your favorite artist personally. Now he's bringing you their stories.
I'm Andy Chrisman.
In his new podcast, 1 Degree of Andy, he sits down with the voices behind the songs for real, honest, and faith-filled conversations you won't hear anywhere else.
That's a great question.
If you love Christian music, this is your backstage pass.
The 1 Degree of Andy podcast.
Listen now to 1 Degree of Andy wherever you get your podcasts.
Hi, everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about.
Well, hi, everyone, and welcome to Alzheimer Speaks. I'm thrilled that you can join us today. We have a very special guest who's been with us before, Kris Sundberg, who is the executive director and founder of Elder Voice Advocates and Elder Care IQ. And today we're really going to be focusing on the state of Minnesota and their long-term care data and what that means, the transparency, the accountability, and what the heck is going on. And she just does such a wonderful job. But before I introduce you to Kris, I always recommend that you go to Alzheimer Speaks and check out all of our free educational resources. We have tons of things to pick from audio and video, things you can download. And then check out our sister company as well, Dementia Map, which is a global resource directory. And if you happen to provide a service product or tool, that is dementia and caregiving related, you should be in there as well. We have both free and paid profiles. So, don't think that, it's going to cost you a lot of money or anything. That's not what either of these sites are about. They're about accessibility and ease to connect people to services, products, and tools. And then last, I'm just going to give a shout out to Q for Good. They are my webmasters. I adore them. And if you're looking for somebody who is very good at what they do and is accountable and timely and reasonably priced, go check out Q for Good. So with no further ado, let's introduce you to Kris. Well, Kris, I'm thrilled to have you back with us. I always love our conversations. You are so knowledgeable and are doing such amazing work here in Minnesota. I just hope it spreads throughout our country and around the world. It's just really fascinating and really powerful. So first, I want to thank you for what all you do for our elders. It's just absolutely wonderful. So I am going to have you introduce yourself, give people a little background on who the heck is Kris.
Okay, well, thank you. Again, I'm Kris Sundberg. I'm Executive Director of Elder Voice Advocates and Disability Voice Advocates. We're going to have our 10-year anniversary next year. It's been a phenomenal decade to work in this arena. And, and when you mentioned, hoping we go a lot bigger, we are going bigger. We've just moved into South Dakota. We got funding to do that, and we're bringing our Elder Care IQ screening tool there. The Department of Health there has been phenomenal, and organizations like the Alzheimer's Association, AARP are really awesome partners. So that in general is who we are. And you ask about memory care. So much of what we hear at Elder Voice Advocates has to do with people trying to live a decent, safe life in memory care. And it's a challenge. And so we live it every day. We hear the stories every day. And we're trying to find the solutions.
And it's important to, raise the availability in the stories and get accurate accounting. And ease of access for people to be able to find this information, because most people don't even know that they could reach out to the state and go through their database, but then they get there and the ones that do, it's so complicated, and you guys have made it so simple to do. And, the things you've done politically and stuff are just amazing here in Minnesota. Now, I always like to ask our guests if you have been personally touched by dementia in your own family or circle of friends.
I have not. I've been one of those fortunate few, it seems, that hasn't been. It's only professionally.
But the stories that you've heard are unbelievable. And we're all aging, and so we have to protect our elders. I mean, I'm definitely officially in that category. And as much as I don't want to admit it, I'll be 67 in a couple of months, and, creeping up closer all the time. And you evaluate those things a lot more, I think, strongly, when hey, that could be you anytime.
Exactly. And we're hoping to also get to, oftentimes it's our kids who are helping us out. So we're hoping to get a better outreach to that age group, the 40, 50, 60-year-olds, because they're the ones that are helping. That was my case, for my dad too. A never-ending challenge.
And people need to know their options and who they can go to and talk to when something's not right. I think a lot of times people feel that if the care is substandard, how do I address this? And if I bring it up, is it going to get worse? There's so many things involved, and we could go down the whole rabbit hole of that. But today we're really going to kind of try to focus on Minnesota's long-term care report. If you can summarize what the heck is in that thing, and why do you think it's so important and necessary?
It's the only report out there that really takes a look at the state of our long-term care, and it starts with the substantiated investigations, because before we were getting calls all the time, we need to find a place for mom, for dad, whatever, and what would you recommend? And the Department of Health is where we always recommend it. But like you said, Lori, trying to manage your way through that very dysfunctional website was tough. So the idea was, let's take a look, what's really happening, let's report on it, and then let's take a look at possible solutions for what we're seeing. So that was the reason to do this report. The other reason was, and what made it possible are a couple of things. The Department of Health every week issues the latest substantiated, unsubstantiated, inconclusive reports of abuse and neglect and exploitation. So we've been keeping track of those all year and keeping a database and growing a database on that. The other thing that helped us do this is the launch of Elder Care IQ. And we're starting to be able to now get deeper into the data. For instance, staffing data. And you know how important staffing is to everything that we do. So the combination of all of that, and then coupled with the growing alarm of the for-profit operators and the poor care that they provide. We all have seen examples. We all know there's a problem here, but Minnesota really hasn't taken a deeper look at just the scope of it. What is, and that was the other real reason for this. Senator Scott Dibble was clear last year that he was going to be providing some legislation to start putting some regulation around for-profit operators, and knowing that was coming down the pike, plus needing to get a better handle on what's really happening so we could communicate that, drove our desire to do this report.
Well, that's good. It's just such a scary thing when you're looking. As I was telling you offline, I had to step back into this again. So, as a real estate agent years ago, before I got into Alzheimer Speaks, I used to help people transition, and I knew what housing looked like here, and things were really pretty good, and things have changed. And then with my mom, dealing with her, I was in the thick of things, but she's been gone over 10 years, and now I'm dealing with another family member. And I looked in November, and I gotta say, I was sadly disappointed in what I saw and what I heard. And it was literally scary. And, buildings can look big and beautiful. People can have big smiley faces on. But when you start getting inconsistencies in messaging, the same question to different parties and not knowing the answers, or, very different answers. I mean, it was spooky. And then we ended up, leaving her at home still, and then now placing her now. And the difference in terms of looking at places and finding one that in your heart, feels really good. But it's hard when you're out there and if you're not finding something that's different, and everything seems to be the same and it gets confusing. It's really hard to know what's what. I used Elder Care IQ quite a bit looking, because you don't always hear what's going on. It doesn't always hit the news. And that was interesting in terms of even what staff knew or said about those incidents that were in their own communities as well. So this is something I think, this report we have to look at really closely and realize how helpful this can be, and hopefully make even more changes to protect our loved ones and possibly ourselves in the future.
Well, and I know it's tough to take a look at reports like this because it is alarming. But we're in a world where ignorance is not bliss. We really have to educate ourselves. And I want to make clear, there are good providers out there. So I don't want to paint this as though everyone falls into this category. But we have way too many, and especially in assisted living. Because when we took a look at the substantiated investigations, nearly 80% of them were in assisted living facilities. Now, I've got to point out that they dominate the assisted living arena, and there's a very good reason. They're making a ton of money. They wouldn't be there if they're not making a ton of money. And so we really have to, I want them to be profitable. I really do. I'm not trying to put anybody out of business, but we have to make sure they provide the care they say they're going to provide. Don't look at their chandeliers and their fireplace and all of that. You really need to dig further and deeper into all of this. So, and then if memory care, if you're looking at memory care, oh my gosh, it is totally buyer beware, because over 80% of the substantiated findings in assisted living with memory care.
Hi, everyone. If you've been injured in an accident that was not your fault, listen up. We have legal professionals standing by to answer your questions for free. Call now and find out if you have a case and how much it's potentially worth. Call 800-710-5100. I'm here with spokesman John Wolf. So, John, tell everyone listening who should call right now.
Well, Maria, first off, thank you for having me here. It's always nice to answer the listeners' questions. Now, as far as who should call in, anyone who's been injured in an accident and think you deserve compensation, give us a call right now. 800-710-5100. You'll find out if you have a case and how much it's potentially worth.
Thanks, John. You heard it, folks. Take advantage of this opportunity and call now. 800-710-5100.
Advertisement sponsored by Legal Help Center. May not be available in all states. Not available in California.
we're in the memory care arena. So and when you look at the deaths, I made a particular focus on looking at the deaths because that's kind of the canary in the coal mine. And it's difficult, we know that the deaths that we were able to confidently determine was caused by the neglect, usually, and sometimes abuse, is far understated. But last year, our conservative estimate or data says there were 23 deaths and in long-term care. 21 of those deaths were in assisted living. So this is a serious area. We need to take a deeper look, and our public policy has to be substantially improved. I mean, we just are not moving the dial here the way we're going at it. Our Department of Health is falling far behind in its regulatory oversight. Legislators need to really step up. It's tough. I realize that it's tough stuff. You gotta have impactful regulation. That means, the long-term care industry is not going to like it, but you got to do that. And you got to spend some money on it. And we've got tight budgets, which is making all of that challenging.
And they have to have the manpower to do the surveys and all of that stuff. And I think for me, one of the things that I would like to see change just from a family member, because I think it would change the dynamics of the community, is it seems like we've gotten so focused that they're not charting anything relationship based or putting a smile on somebody's face. It's just get it done. And when you've got those staff shortages that we have and that high rate of turnover, comfort isn't about getting a task done. It's about how you get that task done.
Exactly. And that person to person, caregiving, real care in the giving, not just slopping dinner down in front of them, which might be a bologna sandwich or something like that. It needs to be what you would hope your mother, your grandfather, whomever would get. But we're not seeing that in too many places. And I often do not blame the staff for that. That is often the case of understaffing. And we see statistics out there that say at least 67% of assisted living is understaffed. Others say over 90% are understaffed. And this isn't a new phenomenon. I think people are thinking, this is something new because of our recent challenges. This is decades old, and it's a practice of controlling costs and improving profitability. And I empathize. A lot of these staff people just cannot keep up. So they know they're giving crummy care, and many of them don't like being in that position.
Yeah, I did an interview the other day with Educate, who does training and has like virtual, like the live dementia training and stuff, and Senni, which happens to be an incontinence product that's just spectacular, and they are doing a collaboration to train staff and get the right products in to like incontinence is just a huge task, but yet it's on the paper of just go change them. Mm-hmm. No, it's a shower, it's bedding, it's redressing, the list goes on. And when management isn't really taking all of that into consideration, they're overloading them with these tasks. And when they're frustrated, especially a person with dementia is going to be mirroring those things back. And someone who doesn't have dementia is going to be intimidated, which the person with dementia could be as well, when people are short with them. And, to me, that's when some of these things happen, or somebody can slip in urine. The list just goes on and on and on. And I think the industry needs to look at more partnerships like that can work together reduce some of these situations that could be controlled in a much better fashion and have a much better result from how people feel about doing their jobs and how somebody feels about being cared for when they need that assistance. It would save money and time and increase reviews. I mean, I can't go on and on enough about just that example, but it's changing the mindset of ownership and what they get out of their budgets. It's like redecorating is nice, but it doesn't change the day-to-day function. And so if you really want, less probing and probbing into what are you doing, do things different because it's evident it's not working the way it used to work. And then you're building teams that really want to work together, because that's to me, a big downfall is we don't have teams. We have employees, but so many of them in so many organizations are not true teams. And everybody needs help, but it's like, nope, not my job. And when you're out there and you see a team function, I mean, I just gush because I don't see it as often. It used to be normal, That's how we function. But I think we've micromanaged ourselves into extreme chaos, with a lot of this stuff.
Well, I really like this partnership concept that you're talking about, and we're trying to pursue that. The Home Care and Assisted Living Advisory Council collects fine monies, and now they are taking applications for grants. And so Elder Voices applied for a grant where we would like to work with the providers and give them some insights from the family perspective so they can better work with the families. And we also would like to do more work with the family members themselves. But I think when I hear some of the reports and some of the responses families get, no wonder they went ballistic, the family member. I mean, they're treated very poorly, disrespectfully, etc. And, the other thing, too, related to all of this, some facilities are putting in dangerous policies that really put the residents at risk. And one of these is the no lift policy. You probably have been hearing about that. Well, after the incident in Golden Valley last year, where the 79-year-old man was trying to transport himself to his scooter, and he's slowly falling over, trying to upright himself. And this took several minutes, by the way. And he went all the way over, upside down, wedged between the scooter and the wall, and suffocated to death. All of this while one staff member who was washing tables turned around, looked at him, and turned around and went back. It was at a point he could have easily gone to assist him and get him upright. And then the manager comes, looks at him, doesn't touch him. And 9 minutes later, they finally call 911. That's crazy policy. That's just crazy. So I do think we're going to get legislation passed that's going to hopefully address that issue. But we have to work together. These are, and that's going to be a challenge. Advocates and the providers, and understandably so, come at things, from a different perspective. But we need to start working together and understanding the perspectives of each other. We'll get there then if we can do that.
Yeah, I saw that particular one on the news, and I had read about it as well. And what amazed me with something like that is I get they're trying to limit their liability. Add a clause to your contract in an urgent matter. Would you like us to? I mean, what family member is going to say no to that? Because, they can say, well, we're going to wait for 911 because they're trained. Well, 911's not always there in a timely fashion, and even if they wouldn't have lifted him up, they probably could have repositioned him a little bit so he could breathe and wipe things from his mouth. I mean, I was sitting there going, oh my God, there's so many things you could do. And I'm not a medical person. I'm just a normal person going, this should not be happening at all. And how do people sleep with themselves with that type of policy?
And we're fortunate because this was caught on video.
Yes.
How many things are happening that are never caught on video, therefore don't have a preponderance of evidence? So it goes nowhere. We know a lot. And that's why I'm a proponent. As much camera usage, the better. It keeps everybody safer. I know one family member said it was so helpful to have a camera in the room because she could alert the staff, hey, I just see something happening. Can you go check? Well, that's the kind of partnership we should be looking for, because we don't expect them to be in the rooms 24/7. That's not possible. But anyway, I go get to
no. No, it's all really important stuff. So don't apologize on that. And that was a wonderful example. And some aren't that extreme, but others are. I mean, I was shocked kind of reading some of the stuff over. What all was happening in these communities. I also liked when you talked about the partnerships and, for staff to understand family, but in family need to understand staff. And that's one of the trainings I do is for staff. Why do families act the way they do? And it's like, because they don't trust you yet. This is a loved one, and when you state it out loud, why somebody's looking for issues, it's because they want to make sure their loved one is protected because you haven't given them anything to trust yet. And so then the staff kind of scurry down the halls, because they don't want to interact because, there's this friction on both sides, and it's really an easy thing to maintain and develop and come up with this teamwork, but it's knowing why people need what they need. And you can turn those people into huge advocates. I've seen that done. I've been part of that in communities where you just get that communication open because family does have insights to their loved one that can be very helpful to staff, and staff will have insights that will be very helpful for loved ones when they visit. Exactly. And if we get to a point of being, getting the staff to be kind of family by choice and working together. We have all these mixed families now. This is just another level, but we're pretty far from that in most communities. Not all. There's definitely some great ones, or just one or two fabulous staff can make a huge difference, in a community. But again, there's got to be the training and the right type of training. It's really humane. Well, why don't you tell us, is there more findings? I would imagine in this report. I'm sure it's a zillion pages long.
Well, one of the things that we took a look at is staffing. And what it tells me, in Minnesota, we have a uniform disclosure for assisted living. And when we worked on that law in 2019, we knew it was a fairly weak disclosure, but we had to compromise away. Well, now after trying to use it, we see how weak it is. In one of the areas, they are asked to give staffing counts. And so I took the best number that they have, the highest number of staff. Usually they range it. It's shocking. It's shocking to see how many. There was one that had one person to handle 70 residents. There's no way in heaven's name that can happen.
How do they even get licensed with that?
Oh, isn't that the question? It really is. And then, but the really disturbing part is how shallow and incomplete the nursing reporting is. you've got to know how many nurses are on staff. And, the CMS standards, and these are minimal. I mean, these are bottom line standards, are 3.48 staff, per hours, per resident. Well, that equates to, one person for every maybe 7, 8 residents. Well, when you're seeing, one person for 70, and it's really common, very common to see most fall into the 10 to 20. And that's taking you way down there.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
So that's why it's so important to ask when you're going to visit the place, how many staff, how many overnight, and how many nurses? Are they nurses that are taking care of multiple facilities and only available from a phone call? Or are they really involved? Are they really getting the assessments done that need to be done? And so we will be next year pursuing legislation to strengthen the disclosure. We've got this. Transparency is everything.
Well, and who are they? Is it the maintenance person and the cook that isn't involved on the floor? Is it the front desk staff? I mean, I've seen that stuff merged in. I've also seen on, where the whole disclosure is, which I'm going brain dead on, that you just mentioned, laying out all their services for the assisted living and that also has memory care. There's no, on many of them, there's no specifics for the memory care. It's all what's in the assisted living. And I'm like, no, you cannot just check on them once a day. No. Where is that? And so if they're providing that service, they need to list those services specifically out for that memory care and not just put it under this umbrella, because that's a very misleading and very scary. And I know not everybody reads contracts. I do. And so that I'm like bulleting, people going, hey, well, no, we don't do that there. Then where's it written that you do it?
Yeah. Well, I learned that, Lori. I took their word.
Mm-hmm.
It wasn't in the contract. I took their word that they were checking on Dad if he didn't come to his noon meal.
Mm-hmm.
I found out the hard way that didn't happen. And, it gave me a false sense of security. The other issue here is we need to start mandating these kinds of disclosures. Right now, public policy makers are so adverse to mandating. You need to fill out these uniform disclosure forms. You need to tell us how you're spending the money. We need to know where you're spending the money, those sort of things. 2 years ago, we got the assisted living or nursing home Transparency Act. So it was not requiring, it was asking for them to disclose various operational and financial information. What's clear is the pretty please does not work. You need to mandate it, and this isn't mandated. Therefore, participation is very low. So there you've undermined the transparency of everything. There's one thing I would say to all of this is transparency is the key to everything. We as consumers of long-term care need that to make intelligent, informed decisions. Policymakers need that to make informed, intelligent, policy, etc. So, it's a frustration, but we know we're going to have to keep on fighting that battle.
Yeah, well, and I know like with a lot of our nursing homes and well, a lot of communities, period, but nursing homes in particular, just around the nation are really struggling to survive. And I saw a title. I haven't read the article yet at McKnight's where they were talking about, the private companies that are lining up to take these things over, and it's not going to get better because the funding isn't scrutinized as much in a private company than it is in a nonprofit, and the philosophies typically are significantly different in terms of care. So it's going to be really interesting. It seems like right now everything there's a push to get everything into privatization, and
no,
yeah.
As soon as that happens, there are numerous studies. The care plummets.
Mm-hmm.
And then, they extract all of the assets out of and then dump it and then move on to the next one. It's a business model. It's not a care model. And we have fundamental issues in how we provide care here. So nursing homes and assisted living. But assisted living is less regulated. So I can see, the issues with nursing homes. But, we probably need to take a look at reimbursement rates. I'm okay with that if there's full disclosure of how that money's being spent. Where is the money going? That's when the boat brakes get put on. When I mention full disclosure, then I'll support rate increases. And government, we've got this fraud problem. Well, there's fraud going on day in and day out in these assisted living where residents are spending many, many thousands of dollars for care they never receive. I mean, that's fraud. It's not how it's being interpreted right now, but it really should be, because too many aren't. And then they're just told, well, you got to hire additional people to come in after you're paying $10,000, $12,000 a month. Are you kidding?
Yeah. The prices. I was talking to somebody in Michigan, and they're like, "Well, our prices aren't that high," and I'm like, "Well, I just recently looked, and they are, and those aren't even the highest priced places by a stretch, So, we've just got to do better. But I think when you were talking about getting the family's voice heard in terms of what is important and for staff to understand and upper management that you can say you're contracting for this person to live here, but the family is expecting education, communication on top of safety, and all the daily living tasks that need to be done, and monitoring and medical and all of that. And, when you package that together, everybody gets calmer. Everybody, works on the same page. Even like when I do trainings, I'm like, invite the family. Oh, no, we staff might say something that could embarrass us. If you have a good facilitator, those questions that staff has or that statement is being felt by other staff, but probably other families, just in a different point. Yeah. And you make it normal and you tell them it's a good question, because there is no dumb question. And, you get them thinking about what the other side is doing so that they can work it as a team, and you can educate them both on the same stuff. So one person isn't more knowledgeable than the other one. It starts to even out and open up conversations and make it more of a friendly, family type environment. And that can save companies so much money, by not having the family feuds going on or staff getting frustrated and leaving, and the care, cooperation between. I mean, I can go on and on and on and on. I mean, it's ridiculous, but it's this good old boys model of this is the way we've always done it. And so this is the way we want to continue to do that, instead of really getting creative and making it a win-win for all sides. Because like you said, these companies got to make money. Employees have to make a substantial wage to live, but people still have to be cared for.
Amen to all of that. We need, if we could only get to the stage where threats, retaliation are not the go-to method in many of these places, that instead it's sit down, have a open conversation, both in families too. They need to go with the same openness and consideration. Come up with a plan that makes sense, that for both, like you said, a win-win. I'm totally with you on that.
Well, and I experienced, I can't remember what company it was, and it doesn't make any difference, where, I read the written reports of what had happened, and I addressed higher management on it, and they just denied it and poo-pooed it, and that family's just kind of crazy. And I'm like, excuse flipping me. I want, even when I go in, I ask them, how did they do on their last survey? Have there been any issues? And I found some people either didn't know or lied to me. And then I would tell them, well, you might want to get familiar with this, because that's important in terms of how are you going to correct that. And if it's happening, like I went to one place for a tour and I loved it, and she said, I got to be honest with you, our reputation is not the best. We are in a rebuilding phase, remanaging. And she was just boom, boom. And I was like, I so appreciated that, because right away I felt like I could trust her.
Right.
Right. And that makes or breaks your relationships. Trust.
Exactly. Just be open with each other.
Yeah. None of us are perfect. We know things are going to happen. They just don't have to happen as often.
Well, and too often, too, when people want to give us testimonials, about our work, but I don't want my name to it, because if I do that, there's going to be retaliation. And that's a sad statement, and we should never allow ourselves to get there. But in too many cases, that's where we are.
Well, that's why this report is so important. Are there other key findings that you wanted to share?
Well, Lori, I wanted to say how you're using the information, these reports, is exactly what we encourage people to do. Take a look at. That doesn't mean you necessarily say, I won't go there, I won't consider them. But like your experience was, when you take that report and you bring it to them and they say, yeah, that was a screw up, but we've done this, and this to correct it. Or if you get a response that's very defensive, or it's the family, they're obnoxious or whatever. And some are, I get that too. But nonetheless, you got to take these things seriously. I would, for anybody who's viewing this and wants to see this research, go to our website, eldervoiceadvocates.org, and it's on there. I think one of the important things that we included in there were the examples of the cases, so people knew how grievous so many of these are. They are not a lost sweater complaint. These are really serious care problems, and again, we're not doing it to scare people. I've had, when we do some of these presentations, you're scaring me. I'm sorry, I am scaring you. But again, I come back to ignorance is not bliss. We need to just go in this and learn how to best sort through and screen the best.
Absolutely, because they'll be the first one knocking on your door going, why'd this happen to my loved one? It's
exactly. And we should do that. So, one of the things I would point out when we're looking at what actually happened, a huge majority of them are from neglect. So, and that points to understaffing. That's a direct correlation there. Out of all of our findings, that was by far the leading reason. And then physical abuse came second, which, and my goodness, when you see some of the reports, I mean, one was a case of a staff person chasing a memory care resident with a knife.
oh, jeez.
Can you imagine the terror of this? And some of it's taunting and making fun of and belittling and things like that. It just, and then medication errors are right up there too. And that again is training. It's processes that aren't adhered to in staffing. Again, people that are rushed trying to get, they make mistakes. And some of these are lethal mistakes. One was a person down in Rochester after a transplant, never got the transplant medication to prevent the infection.
Oh my gosh.
Nearly died in the hospital as a result. I'm not necessarily, where was the RN? How did that fall apart so badly? Thankfully, this person survived, but some don't.
Yeah. And everyone, reacts to medications a little bit differently. And
Yes.
So that's so important. When you were talking about, just the belittling, when my dad, who did not have dementia, was in a nursing home, he told me that when he was showering that two women were just really abusive, in terms of comments and things like that. Mm-hmm. And I wasn't sure if he was remembering correctly because we were having some issues, but it wasn't necessarily dementia. And they really had a really strong team during the day.
Mm-hmm.
But it ended up being people at night. And I did not pursue it because I kind of questioned him and then things weren't lining up. And at his funeral,
caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
A staff person, I'll get teary-eyed, wrote this beautiful card. She came and she talked about how my dad was like her dad that she'd ever had. And she wrote in there, I'm so sorry I didn't protect him because I asked her, did this happen? And she said no. And it was because she was fearful of retaliation from those other staff.
Yep.
And I was so mad at myself. But, that was, Dad died in 2001. So it was way before you could even get a camera anywhere to get any proof. And I just felt so bad. And she just broke down. She felt horrible. And it's like, that is not acceptable. That can't exist in these situations. That is just horrendous. But you do see a lot of organizations that leave toxic people in and they destroy their good staff. And
They do.
they set new standards. And I see that and I hear that way more than I'd like. And it's not just in healthcare, it's in all different companies, because somebody doesn't, I don't want to get sued because that person's crazy, you know?
Yep.
And so you let crazy run the ship
Yep.
and control things. Which,
We had one staff person come to us and said, I just couldn't stand it anymore because of the toxic environment. And again, it's just a handful of people, but that place lost a really excellent employee, but just for the same reason. You know, the other thing I think it's important to talk about is this concept of wandering. And 3 of the deaths were from residents who left the facility nobody was aware of, and were found later either frozen to death or whatever the situation is. And in reading some of those cases, there's some technology gaps that weren't in place that would have helped. And again, it comes to understaffing. They're not, monitoring, the entrances and exits, and we really have to do more on it. That shouldn't happen. Those are deaths that should never happen, and many more happen, and fortunately don't result in death. But how many times have we been told? I have. Oh my God, my mom was found walking down the busy street, in the middle of the night or whatever. In middle of the night, now that I mentioned that, as we all know, it's probably the biggest risk time, especially in memory care, because nighttime, daytime gets screwed up for people there. So the minimal staffing during the evening, nights, just really are a danger to everybody.
well, and it tells you they're not doing the checks, especially in memory care, that they're supposed to be doing, or they would have caught it sooner. I read one report where someone had gone and then they just kind of assumed that family took them or something. And it was just like, oh my gosh. And so it was really a long period of time. And I just thought, oh, they are so lucky I was not that family member. And then they didn't notify the family right away. They waited even more time to notify the family that's missing. And it's like, if you're close and if you're really involved, you're going to have your butt over there driving around looking, and have and it was just like, oh, it just didn't even make any sense to me on so many levels. But the tech gaps can really, like you said, can really help with that. And why they don't have, especially at night, they could have alarms on those doors and with the camera to see, even if it's a little ring camera, to see who's coming and going. Because staff in a building, they want to know who's in the building too.
Sure. Yeah. Nobody wants this to happen on their watch. My God. No. So one of the things I would really encourage people to do is talk to your legislators. Let them know this is a hugely important issue, and let them know about your own experiences and bring it home to them. One of the things we did this fall is had a series of individual legislator meetings where we took our elder care IQ tool and showed them their district. Here's what's happening. It was light bulbs. And it was, oh my goodness, for most of them anyway. Can't say enough about, we won't get any meaningful regulation this year of the for-profit operators. We need to get that. We need to have that kind of accountability, not to make life miserable for them, but to make life livable for the people that are residing in these places. And we just can't let that continue. And our society and we go back, these are issues that are so huge, but our ageist society is having a hard time getting a handle on this. If you kill an American bald eagle, you didn't need to do it. $100,000 fine on the first time you did it, and plus jail time. Here in Minnesota, you responsible for the death of a resident, max is $5,000 fine. That's it. That's all.
Wow.
Or you abuse an animal in Minnesota, that's at least a $10,000 fine plus 2 years in jail. How is it that we can so undervalue the life of an older person? And like in this case of the man who suffocated to death, the lift situation, his daughter said, how can his life only be worth $5,000? And it's not that she's trying to make money off this or anything. It's accountability. It's about responsibility. And so we need to really, I'm all for protecting animals and eagles and children and everything. Let's give the same consideration to older folks.
Oh, exactly. When you were talking about care and things, and all of a sudden I got an acronym that came to me for CARE: conscious accountability in a respectful fashion that's economical, because it's got to work for everybody.
It does. It really does.
And it doesn't have, it's not, you're not after this attack mode. You're trying to just level things out so that they make sense.
Yep.
And nobody wants liability. Nobody, people want to avoid that on all sides. It's emotionally and financially draining and, time consuming and stuff. It would just be so much easier if people were educated and we get feedback from all the levels, not just the top down, not just the bottom up, but the families, the whole 9 yards. And once you get those voices together, I've always said this about dementia care, that it can't be sustainable if we're not inclusive of all voices, because everybody's seeing something from a different angle. Everyone, if you believe it or not, is bringing something to the table, good, bad, or ugly. And that makes the package.
Just yesterday, I was invited by Leading Age to come and participate in a panel discussion for a group of their providers. And I am enthusiastically looking forward to that, because I want to have that kind of open dialogue. That doesn't mean my advocacy hat is taken off, but I really want to try to develop more of a collaboration. There's always going to be areas we just won't come to terms on, and that's fine. So be it. But there's plenty of other areas. If we talk it through, we can find a middle course there, and that's what we're looking for. We can find workable solutions.
Yeah, it's not a right or wrong or don't cross party lines. It's doing good for the people, and that means compromising. Not everybody gets everything they want, but you're still moving the ball forward and improving things. And it's just, to me, and again, it's just the way my brain works. It's like, that is just common sense. So excuse my language, but where the hell did that go? Why is it so difficult? It just shouldn't be this hard, because when you put the equation of common sense in, everything gets easier and people understand even what the mission is, because you're going from this rote procedure or mission plan to being one of heart-centered, that people understand through storytelling and cooperation and helping. I mean, it's a beautiful merge of those things.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to Ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And it's hard to do. You know, day in and day out, I just hear the horror stories. So it's hard to kind of not let that infest, within you, so that you lose your sense of how to really improve things. And it'll be tough, but we'll keep working on it.
Well, and I think sometimes too, when we take on these big goals, is people automatically think it's going to be complicated and it's going to be hard. That's where everybody goes. They don't like change, so it's going to be complicated. It's going to be hard. It's going to cost a ton of money, and it's not going to work. And that's just kind of the mindset. And I go back to thinking about culture change stuff that I've done in communities where it doesn't have to cost a lot of money and it doesn't have to take a lot of time. It's about embedding a rule that might be something really simple, like when you're walking down the hall, you're not on your phone and you're not on your tablet, and you're actually giving eye contact to and saying hi to staff and to family members. Yep. That costs you nothing, and it has a huge impact, and it's being modeled, and it creates trust. And I mean, it's a very slow, simple change, but it makes people also feel connected to what they're doing. And it gives them a better why when they're doing a task. My why is because I want to see that smile on Mary's face, or I want to hear Don laugh or tell his goofy joke when I walk by the hall, because it lifts me and it makes him feel good too. Exactly. And it just makes your job easier when we have those little teeny things, but we've taken the bulldozer in and gone, no personal relationships anymore, no connections, just get those tasks done and get them done now. I don't care if you're short-staffed.
Yeah. We gave a care extraordinaire to a staff person in Rochester, and she was the activities director. And she's exactly what you want to see. And every time I've gone to visit my cousins who are in that facility, I walk in there, I hear laughter. And that's residents and staff. I see people, milling around in the central area. And this isn't a fancy place either. But those are all signs that something's going right. And the particular person just goes out of her way. She's eye to eye. If they're in a wheelchair, she's on her knees talking to them. It's all that special. In her case, just comes natural for her. But it makes such a huge difference. She's loved by everybody. And what a difference that makes. And those people, one person that came just wanted to stay in his room, just refused to come. She's coaxed him slowly, and before long, he was out there socializing with everybody else. But that takes a little extra effort. You need to reach out, you have to go to them, and you need to find what it is that really resonates with them. So there's so many good people like that. I wish I could clone them and send them over the place,
One of the things they do overseas that is really interesting in some of their communities is they do vulnerability training. They don't do dementia training, they do vulnerability training with their staff. And they get the staff to open up about their own lives and where do they not feel comfortable, and share it with the staff. So now everybody knows everybody's vulnerability, but it allows them to support one another, and it allows them to realize they are dealing with vulnerable adults, and it makes them look at their situation different when they're moving in, and how important it is to feel welcomed and part of. And it's a whole different approach. They wear pajamas at nighttime to help get people time oriented, and that's just part of what they do. They eat their meals with the people that they're serving. So it's not here's, I've seen that happen where the spoons behind them and they're talking to another staff and they don't even know where they're hitting on somebody's face, So there are some, like you said, we want to make sure people know there's some wonderful, wonderful people in communities and organizations, but there are too many situations listed in this report that we can do better. And again, not everything has to be so costly. It's getting that mindset to a heart set. And then, and I think you do that through storytelling, the good, the bad, and the ugly, that things need to change. And then they understand the reason behind the change. It's not just because, the administrator, the owner decided that this is the way, but they know the why this is so important. And
that's what we've tried to do with our Care Bewares. And because we take a look at those weekly reports and then we report on them. And give just a synopsis of it. And again, it's to educate, grow awareness, and that helps people be alert to the areas they need to pay attention to. And we post those on our social media, and it's probably the most popular. Right. I hate to use that word, popular. I mean, but it's one of the more visited sites on our social media. So transparency, huge, and accountability, huge, and reward the good behaviors. And
celebrate them and use them as training tools. I mean, you can learn from all different examples. I had a boss when I was in healthcare working with developmentally disabled, and I love her to this day. But she had this open door policy, and she said, you can come in and you can share with me anything, but don't just come in to complain. Come in with 2 to 3 ideas. And I can't promise you that we're going to take one of those, but it will get on my list because as an administrator, I have to prioritize. But she let the employee feel part of it. And then when it was implemented, they kind of headed it up and got credit for the change and acknowledging that. And it was just a great team building, esteem building. I mean, it worked on so many wonderful levels because sometimes employees feel very disconnected from their jobs and what they can have control over or not.
He was an awesome boss. Wow. Too many of them, the last thing they want is your ideas.
Yep. She had that red pen that drove me nuts, when I was rewriting job descriptions and doing stuff like that. But no, she was fabulous. She was fair and she wanted things to improve, but she also educated me on the process, because you have to work within the system and systems don't change overnight. So how can you make those little changes and step forward that might be off the radar, but is going to impact quality of life
for everybody, even the staff, especially the staff, and, we've mentioned earlier too, fair compensation. We really need to tackle that issue because we can't expect people getting bare minimum wage and trying to provide for their families to also have the emotional and connectedness that they need to provide the kind of quality of care. Not when they're worrying about their family and not when they're worrying about how I pay the bills. And it all comes together. It's all interrelated. There's no one thing that isn't impacted by the other.
Well, fantastic. Well, we should probably wrap up here. So people can go to your website, which is eldervoiceadvocate.org, or you can visit Elder Care IQ as well, which they can access from that site.
Yeah. And contact me directly. I'm very open to that. My number is 952-239-6394, and then just Kris at Elder Voice Family Advocates.
Well, again, keep up the amazing work. You are welcome anytime. I just absolutely love what you're doing and the progress that you've made here in Minnesota. It's exciting to know that you're going to South Dakota now and
it's fun. It's been a lot of fun. And Lori, it's always great to be with you on this podcast. I mean, your advocacy work is awesome. I love working with other advocates, and you're among the best.
Well, thank you. To our audience, I just would like to say, be a giver of hope. Like, click, and share. Join our community at raising the voices of products, services, and tools that people can utilize to help them. And, people are scared to reach out, and they're not sure if Google is trusted or not in terms of the information they're getting. A lot of times they don't even know what to Google when they're having a difficult time. So the more stuff we can push out together and get this out to people, the safer they're going to feel to grab it when they need it, or to pass it on to a friend or a loved one who is in need of information. So again, doesn't cost you a nickel to do that. It takes 2 seconds to click on it on your social media and pass it on. And of course, we always love when you come and visit Alzheimer Speaks and all of our free educational resources, as well as our sister company, Dementia Map, which is a global resource directory. Until next time, see you later. Bye-bye.
Thank you.
Attention, seniors. Are you looking for a community that offers incredible benefits and stands up for your values? Look no further than AMAC. With an AMAC membership, you'll enjoy exclusive discounts on insurance, travel, dining, and shopping. Stay informed with 6 issues a year of our award-winning AMAC magazine, delivering trusted news and valuable insights. But that's not all. AMAC is committed to defending America's future by directly bringing the voices of our more than 2 million members to our elected officials. Join a community that cares about your needs and your values. For a limited time, we're offering a 1-year membership for only $1. Yes, just $1 for a year of incredible benefits and advocacy. Don't wait. Take advantage of this special offer and join AMAC today. Visit amac.us/join now. That's amac.us/join now.